Hi everybody, this is Dr. Ariel Ross with Rooted Physio and Performance, and today I'm here to talk to you all about rotator cuff related shoulder pain. So if you've ever had shoulder pain, I know I have, and it's a pretty common thing, then you probably have heard of the rotator cuff, or what a lot of people call the rotary cuff. And what I wanted to talk about today is just what this area of the body is, why it tends to be painful in certain populations of people, and really like how we can use physical therapy techniques to help relieve this pain and prevent surgery. So the rotator cuff is a set of 4 muscles that exist in the shoulder joint, and these muscles' job is really to help with dynamic stabilization of this shoulder joint. So what happens as we reach our arm overhead is that our rotator cuff muscles help hug our arm bone, our humerus, in towards the socket of our joints. And really their goal is to help keep the humerus centered in the socket that it's rotating in. So it is a ball and socket joint, just meaning that we have a cup formed from our shoulder blade that the humerus sits in, and as it moves, it will slide and glide in that joint space. The rotator cuff muscles, there's 4 of them. We tend to use the acronym SITS to describe them. We have the supraspinatus supraspinatus muscle. We have the infraspinatus muscle. We have the teres minor muscle, and we also have the subscapularis muscle. And these muscles all do slightly different things, but really their roles are to help with rotation of the arm when we're bringing the arm externally out, or internal rotation when we reach behind our back, and also with abduction, which is when the arm is reaching away from our body. So if we think about, people who might get rotator cuff related shoulder pain, this is going to be folks who play athletes or folks who play sports that might involve a lot of overhead reaching, or have jobs that involve a lot of overhead reaching. So we're thinking about, our yogis, a lot of downward facing dog. We're thinking about, maybe people who install cabinets in houses. We're thinking about people who stock shelves in grocery stores. And also, your baseball players, football players, especially the quarterback, and basketball players as well, where there's a lot of overhead movement. We obviously can't forget about as well, like our stick games like lacrosse, also volleyball players can be susceptible to this as well. So if we're thinking about why this pain occurs, it can be a multitude of reasons. So sometimes there's traumatic shoulder injuries, and other times there's non-traumatic shoulder injuries. So what I'd like to talk mainly about today is those non-traumatic shoulder injuries. So this is where we might have pain that we're not even sure when we injured our shoulder, but all of a sudden it starts to creep up and creep up and creep up until the point where it's pretty difficult to use that arm, especially once we're moving it overhead. So when this non-traumatic shoulder pain happens, it can be due to a couple different reasons. It could be due to poor mechanics between the shoulder blade and the humerus. So for example, some folks will recruit their neck muscles a lot when they're reaching their arm overhead, and that can kind of interrupt the way that the rotator cuff muscles do their job. That's just one example. There's a plethora of different examples. Also, just that repetitive overhead use. So again, those folks who are using their arm overhead consistently for many hours throughout the day and not really allowing those tendons to take a break afterwards are susceptible to that as well. This tends to happen in folks who are, 40 years old and over when we're thinking about that non-traumatic shoulder injury. So I like to work with a lot of active adults. So this is a population of people and an injury that I see pretty often. So let's talk about, rotator cuff and how we really diagnose that as physical therapists, and also how medical providers might diagnose that. So with a rotator cuff injury, there are special tests and measures and also clinical signs that'll pretty much cue us in pretty quickly about if this is going on. One of the number one things that I look for is if someone has a painful arc of movement right at about 90 degrees of shoulder abduction. So that means that when they're reaching their arm and trying to reach it out to the side and up overhead, they'll have pain right when that arm is extended out to the side and maybe a little bit higher. They might also report like a catching sensation, or almost like the shoulder feels like it's getting stuck in that range of motion. And some folks will not be able to actually reach their arm further up overhead. There's other clinical signs as well. Usually pain that's worse after an activity is more indicative of like a tendinopathy, which is when there's something going on with the tendons of the rotator cuff. It's one of those situations where we might not feel something in the moment as much as we feel it after we do something. There's also tends to be some pain and maybe some swelling in and around the rotator cuff muscles. The rotator cuff muscles wrap around and insert on the outside of the humerus here. So there tends to be, sometimes people will point right to that insertion point and say, ooh, that's like where I feel the pain. But it can also be a little ambiguous, where some people will say, I just feel pain in the shoulder, like deep in there, I can't really point to it. So when it comes to the medical side of treating rotator cuff related shoulder pain, there is things like, getting MRIs that can determine whether or not there is a rotator cuff tear. And what I'll say about MRIs is that they've done tons of studies on MRIs and any imaging in folks who are about over the age of 30. And oftentimes, if we image the painful side and also image the non-painful side, which is what they do in a lot of these research studies, oftentimes the image looks the same. So there could be, small tears on both sides of the shoulders, but really we're not feeling maybe the tears on the non-affected side. So imaging can be helpful, especially if you've been dealing with pain for a while. But I always tell people, try to go get assessed by a physical therapist first, because if we can avoid that imaging, especially in a non-traumatic injury where there hasn't been direct contact or anything like that, then, it's one less thing to worry about. Other things that on the medical side of treatment that I tend to see used a lot but might not be as helpful as we think are things like corticosteroid injections. And really, again, they've done studies on the impacts of the steroid injections, and really there's no difference between a steroid injection efficacy for this type of pain compared to like an over-the-counter NSAID, like an ibuprofen or an Aleve. So if we're thinking about something that's going to drastically kind of be a big intervention like injections, if they're having that same efficacy as something like taking an Aleve, then, I tend to be, and of course physical therapists tend to be on that more conservative side of treatment. So now let's talk about how we would go about, helping alleviate some of this pain. So again, I am a fitness forward physical therapist. I'm not one of those people who will say, just stop all activity, stop doing everything, because it's not practical. And it also can just lead to a lot of other issues that prevent that full spectrum of healing down the road. Especially in this, again, non-traumatic injury where there hasn't been this big, injury to the arm. It's kind of just gradually come on. I tend to tell people that pain is your guide. So if you're experiencing shoulder pain with certain movements, I tend to tell people, one, we don't want to really push the pain level higher than a 4 out of 10 with movement. 0 would be no pain, 10 would be like the highest pain you can imagine. So that 4 level will let us know, yes, we're putting some impact on those painful areas, but we're not, going anything too severe. Also, when it comes to rehabbing this, a lot of things that can be effective would be, one, like hands-on manual therapy techniques. I think manual therapy can help improve that client and therapist relationship. It also just sometimes feels good to have somebody else move your arm when you're not able to move it the way that you used to be able to. So there is also a local analgesic effect that a lot of the manual therapy techniques have. When we start to get into some therapeutic exercises for the rotator cuff related shoulder pain, isometrics are kind of the first line of defense. Isometrics meaning we're contracting the muscle, but we're not moving it through a range of motion. So you might have seen somebody in a door frame just kind of pressing their arm out into the door frame and just engaging those rotator cuff muscles, but not really putting them through their full range of motion. And then of course, we have to look at just how this person is interacting with their shoulder and in their environment throughout the day. So a lot of it is education on avoiding provocative factors to an extent. We don't want to completely avoid everything. Sometimes it is going to be an active rest process for the first few weeks just to allow things to calm down. And then we have to definitely reload those rotator cuff muscles. So doing exercises where we're putting stress on the rotator cuff muscles so that they can build resiliency over time. We know that the way to improve a muscle's function is, yes, to get it stronger, but also just to build tendon resiliency. The way that we build tendon resiliency is by putting stress on the tendon that's at an appropriate load. So not too little and not too much. If you've had physical therapy in the past for shoulder-related pain and you've only done band work, then I would say that's not enough in order to really push through and build that shoulder resiliency and strength. So if you're somebody who has been suffering with shoulder pain and just thinking that it's going to go away, I definitely suggest getting it checked out by a physical therapist. If you're in the Maryland area, Central Maryland, I'd be more than happy to evaluate your shoulder and check it out. Because I think this is an area where a lot of times we kind of let the shoulder pain go on and go on and go on, and then it becomes a chronic issue. And at that point, it is a little bit more difficult to treat once things have been, past that 6-month mark of being painful. So I really appreciate you all listening. If you have any questions or comments, definitely leave them in the comment section. And I hope you all will subscribe as well to our channel here for more physical therapy and fitness forward physical therapy advice. Have a great rest of your day and peace.